Yes?
Thank you very much. I mean, it's just following up the last question. Both Namrata and Byron have brought up something very historical but also topical. Yeah. Immunizations are the most powerful program, public health program. And Namrata brought out the issue that it's not the vaccine cases or the deaths or the vaccination coverage. There's something else which she has picked up from the narratives, the testimonies, the documentation. And then Byron also brought up this other issue, is the resistance comes because either the population is not aware or not resistant, or the health professionals. So one of the key elements of health promotion, a very important public health principle. And then we look at today, maybe when you look at the time of smallpox, isn't it that the programs of immunization and primary health care in the 70s and 80s was more stronger than they are today? And that organizations like WHO, UNICEF, and Bill and Melinda Foundation are not investing in the right places, but maybe not investing in making sure the delivery happens.
Very good point. Good question. I think that would require a lot of discussion. I don't have any immediate response to that, but I think that those are issues that we really have to address, because I'm not sure if the focus is right. I'm not convinced that the work being done now isn't necessarily in the right place. But I don't really have an answer. But that's a good point.
Yeah, João Nunes had in the Global Health History seminar prior to this one, the previous one on Zika, João gave a very interesting presentation touching on precisely these points as to what is happening in the Global South and how are we, how are international organizations and national governments receding and how little invested they are in continuing these programs.
I think it's a serious problem. I think there has to be more dialogue. I think there has to be a larger stakeholders population involved with this process, not just a few people in perhaps I don't know, in a very narrow settings.
Yes, lady at the back here.
I just want to know what is being done to train medical physicians and train medical people into promoting vaccines. I think the communication thing is not working, so how can you give us something to work from?
I think that's one of the foci. I know in medical schools everywhere there's a small, very, very small unit for vaccines. Everybody remembers smallpox, but beyond that, it's limited. And right now there's even an absence of people being trained in family medicine or primary care in many of the CIS countries. And many other countries, I think that the educational process has to occur, hasn't occurred. It has to be part of the dialogue with the healthcare systems that are working with people on a ground level, on the grassroots level, not just simply at the higher levels among policymakers, and involving the communities and the populations as well. But I think it's a good point. It's just not happening in a lot of places. You can see what happened with the situation in Armenia, where doctors, physicians are reflecting pretty much the same thoughts and concerns that the general population is concerned about. What about India?
I really don't know what training physicians are being given about vaccination. Perhaps I should ask them now, since I've invested in this project.
Yes.
Now when I go back for a holiday, I might as well speak to people. But I do know that there was a powerful anti-vaccination campaign, and I've learned it from Neil's work on tuberculosis. So in the 1960s, there was a variety of interests, not all of them uneducated. Some of them were arguing against vaccination as a Western imposition. Some of them were arguing for indigenizing the vaccination process. And there were people coming into the debate from various quarters. And they were citing evidence of deaths in Europe and so on and so forth. So, these were informed opinions. And probably, from your talk, all I can push forth is probably ask people why do they resist instead of just dismissing them, instead of just dismissing their apprehensions. Probably if you probe a little further on where this information, on where this resistance is coming from, what kinds of internet sites they are reading, why aren't they reading the opposing sites? Probably, as you were suggesting, a more engaged dialogue with the people who are also resisting would give us some answers.
I really hold responsibility the countries that are wealthier for not responding effectively to the anti-vax campaign, the anti-vax movement, in part because now it's spread all over the world. And it's also, it's one of those exports coming from richer countries to poorer countries now. And it's not one of those nice exports, unfortunately. And there was a responsibility to respond to it when it was growing, and there wasn't. There was no real effective response. So in some ways, I think that we have to rely on people in a country to kind of effectively change those issues. Everybody has a cell phone now. Everybody has a computer. Everybody has, you know, some kind of contact connection with the internet, and if you go to vaccines, you're going to find most of those vaccine sites are anti-vax sites. Is a problem.
Niels.
Thank you very much. I think we're having a very interesting discussion right now, focusing on this important theme that resistance to vaccination can be many different things in many different contexts. I think it's very important. If I can just make two observations, and you can tell me whether you agree with them. I think historically there's an important difference between those who resisted vaccinations earlier and the ones you're dealing with now. And I would like to quote Paul Greenhoff again, because he once wrote, I think it's a good quote, that if we look at it historically, it is actually the acceptance of vaccines that should surprise us, because foreigners come into the community with some substance that they want to inject into your infant child, and the child will be in pain, and they're claiming that in some future they will not get some disease that you have hardly heard about, right? So this is the historically surprising thing, is that so many people actually accepted vaccines rather than rejecting them. But I think that in your case, what you're dealing with now is a completely different situation, because the anti-vaccine people today are people who knows and understands the medical, sort of the rough medical, biomedical mechanism behind vaccination.
Yeah.
So I think it's an important historical difference between earlier forms of oppositions and newer forms. And the other thing I would like to say is that there are many bad reasons for being against vaccinations. The worst one is probably the one we had in Scandinavia with the cancer one, given to girls.
Oh, that's HPV.
HPV, yes. That why should I risk, if there's a tiny risk for my child, why should I risk my child because everyone else is getting creating herd immunity?
Yes.
You know, that's a really egocentric way of doing it.
Yeah.
But I think there's one argument against vaccines that you might have to take a little bit more seriously, and which I also think connects to this primary healthcare conference tomorrow, and that is that I think that maybe investing in vaccination is not always the right solution. And that I also built on the case that I have studied, the anti-BCG movement in India in the 1950s, where people said that we should spend our limited money on primary health care rather than a vaccine that we don't know whether it's actually effective. And I think that I've heard public health people saying the same about polio. Yes, you can do something with polio, and polio is a terrible disease when you look at the children that has been hurt by it. But basically, money could have been done better if invested in other programs, not non-vaccination programs. So I'm just saying that sometimes, at least historically, sometimes maybe investing in vaccination was not always the best solution.
I know there's still a debate on the current TB vaccine, certainly.
Yeah.
Yes.
As I understood, the distrust to government is growing very rapidly, and I think because we cannot
It's a good point. Actually, there's been a number of studies published that show that the anti-vax sites are much more sophisticated, much more rational sounding, much more polished than the pro-vaccine sites. And so if you look at the two side by side and you know nothing about vaccines, you're going to go anti-vax. Just because it's much more polished, it looks more rational, it looks more reasonable. So there is a real need for even a response on the internet, though that's not a complete answer, to some of the issues that they bring up.
So what would you do if you were a 15-year-old adolescent who would change the world, I guess?
If I were, now it depends on the vaccine. Again, I think I would be focused on those vaccines that really we have demonstrated really make a difference, they're really low risk,